Let's go on to masks, Claire. Belief 10.
Okay, I like this one. I like this one because
I won't ask a question. Just
okay. When I was writing, I was trying to be a little bit personal and honest, right?
Yes.
Because I wanted to engage people, and it's difficult doing that because you expose yourself, and you open yourself up to criticism. And
your enemies will use any weakness that you indicate.
Absolutely. And this one, I'm totally exposing myself because I sewed masks, John. In summer 2020, I got the machine out, I picked out some pretty fabrics that I liked, and I was busy stitching these masks. And I look back on that now and think, well, what was I thinking about what I was going to achieve with that? And, I think a lot of it was around this story of droplet spread, right? It's coming out the mouth spray, it's going to hit someone in their eye and cause them to be sick. And obviously a cloth mask would stop that.
Yeah. You can't spit at someone when you're wearing a mask. Yeah.
No, exactly. And so, I could kind of see that would make sense. But obviously it's a total nonsense. It's a total nonsense. That's not how it's spread. And, even I could almost have been persuaded that if you had the largest volume of virus in that globule of saliva, then stopping that would still have a benefit. But actually that isn't where most of the virus is. The vast majority of the virus is in the aerosols, not in these big globules of saliva. So it falls down on every count. And there were huge problems with people's beliefs around masks because we were told lots of different layers of why they had to be worn. And people sometimes came out and are accidentally honest about saying it's to remind people to, do their distancing and all of the rest of it, because you've got a sea of masks. Now, I know somebody who had night terrors. This is a grown man who had night terrors because of the masking. And he would wake up and screaming because all he could see were these distorted faces as he was sleeping. And, obviously that's quite an extreme example. But the idea that a faceless, smileless society is good for anybody is just completely wrong, because as humans, we need to see, when you've got a stranger coming towards you, you need to assess the situation. And if they've got their face covered, you don't know if they're angry or a threat. And so everyone becomes a threat. Even if you're not scared of a virus, suddenly people are now a threat because you haven't got that ability to have a sort of engagement or that feeling that they're safe or whatever else. And so you've got these impacts from masking that people didn't talk about. They just pretended it was benign, minor intervention, and it wasn't. It really, really wasn't a minor intervention. It was a really big deal.
Sometimes I'm foolish enough to ride a motorcycle. And, you just wouldn't dream of going into a shop or a cafe or a house with a full-face motorcycle helmet on. No. You just look like a criminal, and no one can see you. You just wouldn't dream of doing that.
No.
And yet this was just normalised. And this goes back to our hunter-gatherer times. That the whole reason we've got all these facial muscles is so we can communicate via this amazing non-verbal modality that we have, with this amazing ability of the human brain that we learn when we're just a few months old to read faces.
Yes.
And just taking away that whole aspect of humanity. It was,
yeah.
I actually had a hospital appointment and I went to see a very competent consultant, but he was wearing a mask all the time, and I was just left so dissatisfied with the consultation.
Yes, yeah, because you that engagement with a doctor
just wasn't there.
No, and you think, well, what's the point? If you're just following a protocol, you might as well be a computer algorithm if you're not going to engage with people. And when a lot of the people, a significant fraction of the population who need care from a doctor are hard of hearing, and yet doctors are covering their faces and making that communication harder. And there was one awful story of, I can't remember what it was, but there was some medical disaster that happened because the doctors couldn't hear each other properly through the mask. You think, well, you can see completely how that would happen. And, you can't just dismiss this as being a benign intervention. It's not. It was a major, serious intervention that had no benefit. And we now have Jenny Harris, who was deputy chief scientific officer, who said
chief medical officer or something, wasn't she?
Yeah, that's right. Sorry, deputy chief medical officer. She said that the masks, the evidence base for masking was that it didn't work, and you might get it on your fingers if you keep fiddling with them, and we shouldn't use them. And then said everybody's got to use them, and now she's back to saying, well, we know the evidence base says they don't work. You know what? Great. So do we trust you at all the next time to, actually tell the truth? No.
Let me think about that one, Claire. I'll have to get back to you on that particular doctor.
Yeah.
It's so obvious you're breathing out. The air's got to go somewhere.
Right.
It's just so obvious.
Yeah, and you don't have to, you can just feel the warmth when you're breathing out of a mask. So it's coming out by your ears, right? You're just channeling the air to come out a different way. But in terms of the aerosols, you're still producing your pig pen-like cloud of aerosols everywhere you go. And anyway, you're healthy, and it's the sick person in their bedroom with their window open that's infecting everybody, not you. And then besides that, do you remember we had a mandate in hairdressers that you had to wear a mask at the hairdresser, meaning that the hairdresser is getting all of your air right in their face.
It's not really a problem. Not really a problem I have, but yeah, I do remember that kind of thing. Yeah. And I remember this ludicrous situation where you in some restaurants you could, when you were walking around you had to wear a mask. When you were sitting at the table you didn't. Yeah, it's just absurd.
But everybody went along with it, and then the politicians had it the other way round. So when they were in the canteen, they could sit down and take it off and stand up and put it on. But when they were in the chamber, they would sit down and put it on and stand up and take it off. Like Simon says, just as ridiculous.
Just make up some arbitrary rule.
Yeah.